Welcome to the demonstration of the skill, assisting with a bedpan. We'll show you how to properly assist your client with a bedpan. Watch a caregiver perform each step first, then they will show you all the steps together, from the beginning to end of the skill. Gather your supplies before starting the task. For assisting with a bedpan you will need the following supplies: gloves, pillows, a few towels, toilet paper, a bedpan, and your client. Before you continue, gather supplies to take some notes. It will help you prepare all the necessary supplies and get ready to perform the skill. When assisting your client, remember to incorporate your common care practices, client rights, and swipes process. Common care practices that you need to follow throughout each skill include: identify yourself to your client when beginning care. Use infection control measures and standard precautions to protect your client and yourself. Advocate your client's social and human needs. Promote your client's safety and comfort. And always leave your client with common use items within their reach at end of care, such as their call bell, phone, glasses, remote, tissues, or a cup of water. Communication and client rights means you should explain what you are doing. Engage with your client. Support your client's choice and independence. Respect your client's privacy. Observe your client and speak slowly, clearly and respectfully. For you to successfully demonstrate this skill you need to gather supplies before starting task. Wash your hands before contact with the client. Identify yourself by telling the client your name. Provide privacy throughout care with a curtain, screen, or door. Explain what you are doing for the client. Scan the area to be sure everything is back in place after the task is done. Before starting care, wash your hands. Now you are ready to begin care. Before placing the bedpan, lower the head of the bed. Position the bedpan with the handle toward the foot of the bed. Wear gloves to place the bedpan correctly under your client's buttocks. Have your client bend their knees and raise their hips, if they are able. Raise the head of the bed after placing the bedpan under your client. Put toilet tissue within your client's reach. Ask your client to let you know when they are finished. Offer to cover your client with a bed sheet or blanket. Lower the head of the bed before removing the bedpan. Put on gloves before removing the bedpan. Remove the bedpan and empty the contents into the toilet. Provide perineal care. Follow checklist procedures. Clean and sanitize equipment as per protocol. Return to the proper storage. After completing care, remove your gloves and dispose of them in the trash. Then wash your hands. Now that you've seen this entire skill broken down into simple steps, watch the following videos to see how the skill is performed from the first to the last step. Before starting care, wash your hands. Click Next to continue. Before placing the bedpan, Lower the head of the bed. Standard bedpan versus fracture pan position. Standard bedpan, so the wider end of the pan is aligned with the client's buttocks. Wear gloves to place the bedpan correctly under your client's buttocks. Have your client bend their knees and raise their hips, if they are able. Raise the head of bed after placing the bedpan under your client. Put toilet tissue within your client's reach. Ask your client to let you know when they are finished. Offer to cover your client with a bed sheet or blanket. Lower the head of the bed before removing the bedpan. Put on gloves before removing the bedpan. Remove the bedpan and empty the contents into the toilet. Provide perineal care, following checklist procedure. Clean and sanitize equipment as per protocol and return to the proper storage. After completing care, remove your gloves and dispose of them in the trash. Then wash your hands. After each skill, remember to scan your area before exiting. Kindly, ask and leave your client's common care items within their reach. Congratulations, you have finished this skills video.